Assalamu alaikum, and welcome to another episode of Health is Wealth. It's always a pleasure to be here, to be able to have experts with us and, you know, having that chance to bring about some of an informative discussion. We can sort of dispel all the myths from the actual reality and to give a proper guidance, guiding to people, you know, regarding their health issues. We are going to talk about dermatology, skin conditions. This is something that I would say in today's world people are getting more and more sort of concerned with, and that's something that a person should be. So to talk about today's condition, dermatology, skin conditions, we're very happy to have with us Professor Dr. Ikram Ullah Khan, who's the head of dermatology department in the Pakistan Institute of Medical Sciences. Dr. Ikram Ullah, thank you very much for being with us here today in the studios.
It is a pleasure. It is my pleasure. Thank you.
Thank you. Dr. Ikram Ullah, you have been the pioneer in Pakistan for introducing laser treatment. Tell us about that journey, how you introduced it to Pakistan, and what were people's reactions towards this?
Yeah, that's a very interesting question. Well, before coming to Pakistan, I was working in United Kingdom for 10 years. I did my membership MRCP from there, and I was working in Birmingham Skin Hospital. That takes us way back to 1987, and I have been there in UK till 1996, 97. So I spent 10 years over there. Now, in 1997, for the first time, laser were introduced into United Kingdom, and Birmingham Skin Hospital at that time was one of the very few centers that started introducing lasers in the field of dermatology. And I, at that time, was a registrar in that particular hospital. And I was assigned with this particular task to sort of, in inverted commas, experiment with different skin conditions and how we can treat that with different types of lasers. So most of the common condition at that time, which we would treat with lasers, were like tattoos, because that's very common in United Kingdom, multicolored tattoos. Then I started treating viral warts with lasers, and the concept at that time, which I had in my mind, and I proved that scientifically, that if we stop the feeding blood vessel to a viral wart with a laser, that's a pulse dye laser, we can actually destroy the viral wart. And the results were very fruitful, in fact, because that's again a very common problem. So on, there were many other applications which we started using lasers for, like wrinkles on the face, acne scars. We used at that time carbon dioxide laser for the removal of acne scars and wrinkles and skin rejuvenation. And again, the results were very, very promising at that time.
And then you brought this to Pakistan. How was the reception here? What were people's apprehensions?
I came back to Pakistan in 1996, and I joined PIMS at that particular time. The reaction when I introduced laser, because I knew that at that particular time I had almost 10, 12 years of experience with laser, and I was very, very optimistic about its introduction into Pakistan and the way I can treat people over here, because most of the patients that I came across were with hirsutism, like abnormal hair growth on the face. That was a very, very significant problem at that particular time, and still it is. I have seen marriages break down due to this particular problem. I have seen young, beautiful girls not getting married because they have beard on the face. So I introduced, the first laser that I introduced was hair removal laser. And at that particular time, laser word was not something that was commonly understood, or in fact, many of the intellectuals also did not know what laser is and what particular this machine do, because at that time hair removal were removed with
with other techniques
like electrolysis that would lead to scarring, and it was a very slow process, and the result was also not good, or in fact the result were such that it would lead to scar formation. So hair on the face is better than having a pitted scar on the face. So I introduced lasers, but there were a lot of myth at that time that what would laser do to the skin, would it burn the skin, would laser lead to skin cancer, and what particular laser is, because it's a huge machine and light is coming out, and slightly at that time was painful also. We have to cool the skin. So there were many different questions about the laser. Would it affect the patient pregnancy, or would it have any effect on the on patient with childbearing age, on the outcome of pregnancy? So there were many myths as such associated, and one of the most common myth was that it would lead eventually to skin cancer.
Okay.
So I had to explain to the patient that this is light, this is not rays. People would sort of equate it with an X-ray machine, that because too much rays can lead to skin cancer. So at that time, you know, this was the most popular myth, that, or generally this was what it was conceived, that it can lead to skin cancer.
Right.
So I have to explain that these are not rays actually. Basically, laser is a light. What does laser do? Basic laser is a monochromatic light, which means it does not have multicolors. It has got only one color. That's why it's known as monochromatic.
Okay.
If you shine a ordinary light through a prism, you get a rainbow. You get a spectrum of 7 lights, but 7 wavelengths. Laser particularly has got 1 wavelength, and it is focused and it is collimated, which means when it travels in space, it does not disperse.
Okay.
So the laser light is very, very concise. Now, how does it react on the skin? Now, skin has got different chromophores. Chromophore is a substance we call what absorb little laser light. Like, for example, in the hair follicle, the chromophore is melanin that is present in the hair follicle. So laser light with particular wavelength, like 1064, or for that particular matter 1880 or 1755, these are different wavelengths which can be absorbed by that particular chromophore, the melanin.
And sorry to interrupt you, is the intensity sort of, you know, adjusted depending on the patient?
Obviously, these days laser, the best lasers come with energy meters. They automatically sort of adjust what type of and what strength of energy we need to use to destroy hair follicle. But if then again I use my own clinical judgment, and if I see that the laser interpretation is wrong, then I can override that and adjust accordingly the amount of intensity that we use to treat a particular hair follicle. So yeah, it is very important to do that, because you have to know the color of the skin of the patient. You have to know whether the patient's skin has been exposed to the sun, and you know the quality of the skin, whether the skin is dry, dehydrated, or it is oily. So there are many different factors, and also the thickness of the hair, whether the hair is thick, black, or the hair is blonde in color, or it is fine, and so, or a fizz type of a hair. So a different hair for which we have to adjust the laser and the wavelength also.
Right.
For example, for a thick hair, I would use, and a dark skin, I would use a 1064 laser.
Right.
But for a fair skin and a very fine hair, I would use the Alexandrite, which is a 755 nanomillimeter wavelength laser.
Right.
So,
Dr. Ikram, you were telling us before the program, we were discussing various problems where patients come to see you. We were also talking about unrealistic expectations from some people who come to see you, and you know, as a doctor, as a medical professional, you can see that, you know, they may not require that procedure that they want. How do you counsel them? And also, you mentioned a very interesting condition, dysmorphic condition. Can you please tell us something about that as well?
basically, dysmorphic condition is where patient has got a wrong impression or picture about their face.
Okay.
A beautiful woman or a good-looking man may come to me, and he would say that there is something wrong with my nose, or there is something wrong with my cheeks, or there is something wrong with my eyes or lips, for that particular matter, and I want to treat it. So obviously, it is my duty as a doctor who practice his dermatology in a very ethical manner. I give value to ethics foremost and topmost. That is very important, and that should be very important for every medical practitioner.
Exactly.
So I have to explain to the patient that you have got a beautiful nose. There is nothing that I can do to change this nose the way you want it, because the way you want it may not look good on your face,
Right.
or your lips are perfectly all right. There is nothing that I can do or anybody can do to change it. If we do something, we in fact will do you more harm than good. So that needs to be explained to the patient, because patient has developed that image over a period of months and years, and they most probably have discuss it with their peers and discuss it with their colleagues and with their your siblings, and obviously has developed that type of a particular attitude. So I have to clarify that, and it takes at times multiple sessions for me to convince the particular patient that this particular procedure that you want to seek is not for you, and in fact would do you more harm than good. In most of the cases, at times, finally I am successful in that situation, but at times patient then become disappointed and they go somewhere else and seek a remedy for their so-called dysmorphic image about themselves. And unfortunately, if they land up with some other doctor who does not value ethics that much, you know, because this is a lucrative field, so the patient may actually the treatment may be be exploited and be detrimental to their looks
own health. Right.
And health also at the same time.
Dr. Ikram Ullah, please tell us, what are the sort of like the main concerns that you get with, you know, women, female patients and male patients when they come to see you? What are the usual concerns and what are the usual problems that you're treating via laser?
Like I mentioned about the hair removal, both men and women are concerned about that, because men, they have got abnormal hair at times on the upper cheeks and on the ears and elsewhere. Some of them are bodybuilders, they want to get rid of their hair. Female obviously do not want to have hair on the face which does not look nice, so that is very important, and most of the patients do seek advice for that. Then there are patients who develop sagging of the skin, wrinkles on the skin, and then for that they seek medical advice. Patient may have deep-pitted acne scars that again, you know, they cannot function properly in the society because of their
It hurts their
image.
self-esteem as well.
Obviously, you know, if somebody has got pitted scar on the face, it changes their facial features, and that's very important. I also treat patients with smallpox scar, though it is not very common. Smallpox has disappeared from the world, but still I do get patients with smallpox, and those are the type of patient I feel very happy in treating, because their face is a stigma. Like you look at them and you say, oh, he has got smallpox straight away. And if you try to help that patient and change their facial features, and they become
changed their life.
normal, they change their life, they become normal. Then other very important aspect which give me great pleasure honestly in treating is a condition known as hemangiomas on the face. Now let me explain a little bit. What is a hemangioma? It's an abnormal birth mark on the face. You must have come across patients with a red, big, flesh-like blotch on the face covering almost half of their face, or in fact the entire face. It's known as port wine stain.
Okay.
Now these are the type of the patient, like in the society does not accept it.
Are these more common in fair-skinned people, or
they are common in every, you know, dark skin, dark skin and fair skin people, and so far.
Is it a genetically?
It's a genetic condition. Obviously, it's an abnormal collection of blood vessels on the face. The face look absolutely red, half of the face, and it's also hypertrophic, like it's protruding beyond the boundaries of the face. So it looks like you have put a piece of a meat on the face. So you can imagine how that particular person would look like. Half of the lip is covered, so half of the lip is twice the size of the other half of the lip. So you can very well imagine that these patients, unfortunately, can look like monsters, and they are not accepted in the society. They themselves do not go out, they do not study, they do not go to the school, obviously. So there is a laser now, which is known as a pulse dye laser. It's a V-beam candela perfecta. It's a laser meant for this particular condition. The wavelength of this particular laser is 585 nanomillimeter, and this is the chromophore that is absorbed by the hemoglobin. in these blood vessels and by the blood vessel wall, and it collapses the blood vessel, and after a few sessions the patient face become absolutely normal.
Oh, that must
This
make
particular
such a-
procedure, mind, I have to say, is not cost effective for me. Honestly, I lose when I treat these particular patients, because this laser use consumable, it uses a dye. In the Western world, this laser is seldom placed in a private clinic. It's
Used to its expense.
because it's very expensive to run. So it usually is in the government setup, like back in United Kingdom, it was in the NHS hospital, and we would treat these patients. But unfortunately, it's not available in our government hospital because we have got other priorities, and I do not blame the government for that, because if a hospital needs has limited fund, I would rather recommend to have a ventilator rather than a laser machine.
Of course,
and
yes.
that makes very
It's all about
sense.
priorities, in our
obviously.
side of the world.
So that is something, when I treat these patients, I feel great pleasure. Then there is another condition known as nevus of aorta. What is nevus of aorta? It's a half of the face is absolutely black, black in color. Now you can imagine how that particular person would look. Half of the face is black. So I treat that with laser, with a special laser known as Q-switch laser. The wavelength is 1064, and the KTP, which is half of that, 532. I treat these patients with this particular laser, and after a few sessions, the face become perfectly clear. So a person,
What an
a
impact
patient,
in their quality of life.
quality of life. And they are the patient who are thankful actually for the treatment.
Of course.
They are the one who do not come to me for so-called cosmetic benefit. They do not want to enhance their already good features. They want to get rid of a stigma on the face. Like before the treatment, they are not even considered, unfortunately, very unfortunately, as humans, and then they become a human being and a beautiful person. So, yeah.
Dr. Ikram, tell us about laser as well. Something interesting that I was, looking at: excessive sweating.
Yes.
It can be used to cure that as well. I'm sure that.
Absolutely. No, there are different ways to control excessive sweating. Now, excessive sweating can occur in the palms and in the soles, and also in the armpits, and these are the particular site where one get excessive sweating. The cause, as such, it's a very scientific, lengthy scientific discussion, and I would not like to bore my audience with that. But basically, excessive sweating can be controlled by different ways. One way is to inject Botox into it, into the palm and sole. So it will get rid of the sweating because of these. It is because of overreacting sympathetic activity. So if we paralyze that, so sweating stops for 4 months. But Botox effect is short-lived. Plus, it is also painful. The other method to use to treat excessive sweating is by a process known as iontophoresis. So that different, very minute electric current goes into the skin, and it treats excessive sweating. But you have to do this treatment for a prolonged period of time. And I usually recommend my patients to buy their own machine, because rather than coming to the clinic, buy their own machines. It's not that expensive, and they can treat themselves.
What is that machine called for viewers?
The machine is known as iontophoresis. Iontophoresis.
Okay.
It's a very portable machine, and they can easily treat excessive sweating, because most of the patients, they have got so much sweating that they cannot write. They have to keep a handkerchief with them all the time, and they write one word, and then they have to dry their hand and then write another word. So it's a nuisance, in fact. And they cannot shake their hand with anybody.
And especially the climate that we are in,
yes.
that is something that would be...
The other way to treat sweating, especially in the axilla, we can use iontophoresis, we can use Botox, but I at times use a machine known as smart lipotraplex, where I try to destroy the sweat glands in the armpit with the help of this particular machine. It is a slightly invasive procedure where I introduce a cannula inside the skin into the axilla, and through that I introduce a laser fiber and try to destroy all the glands. This is a very effective procedure, but like again I said, it's an invasive procedure.
Right.
So, but obviously, if a patient who Even
feels that it's
in
affecting their
winters, all
life.
their armpits are full of sweat and they cannot wear clothes. So obviously, this is a procedure worth considering.
So for people who do not suffer from excessive sweating, but the normal sort of sweating that you have in the summer months as well, antiperspirants, are they, we hear a lot of things, controversial things about them. Are they safe to use?
Well, the best thing I would like to tell my patient is to use alum, phatkari.
Okay.
Alum, you know, you can get a rock of alum,
Right.
just smooth it out, and you can just rub it and use as an astringent in the armpit, on the palms, and that can control
Excellent.
excessive sweating.
Okay, right.
In the deodorant, this is what they use. They use alum along with different fragrances and preservatives and other things, which in fact can at times cause irritant contact dermatitis. I have seen patients using different deodorants and their armpit turns absolutely black in color because of and red and scaly and itchy because of use of these deodorants. So I personally do not recommend deodorants as such, but alum.
So that is a great tip that Dr. Ikram Ullah is giving for phatkari, to use that instead of deodorant. And in the part of the world that we live in, it's easily available and something that would really benefit a person. So that is really a great tip there. Dr. Ikram Ullah, tell us please about, many people talk about, because we asked people beforehand about their concerns. Many people, especially male viewers, they asked about hair loss.
Yes.
The causes and the treatment.
Yes, very important. Very good. Thank you for bringing up this question. Basically, the hair loss that we see in men is 99% of the cases is known as androgenic alopecia. Now, androgenic alopecia is a genetic condition, like it runs in the family. What actually happened is that the hair follicle present, especially in the frontal area and at the vertex area, the top of the scalp over here, they have got small little receptors in the hair follicle, which are genetically primed, and when a person reaches adulthood, testosterone is produced in the body. I'm not talking about the excessive testosterone. This is a popular myth that they have got excessive testosterone. Normal amount of testosterone that is produced in the body, when it come in contact with these receptors, small little receptors present on the hair follicle, they detonate and destroy the hair follicle. This particular process is known as androgenic alopecia. Now, how we can treat androgenic alopecia? There are different anti-androgen that you can use on the scalp, like minoxidil is one particular substance that is used for that. There are different tablets that come, anti-androgens, that can be used to a certain extent and can have beneficial effect. These days, I'm using one particular procedure which is extremely effective, and in fact, it is more effective than what I imagined when I started this particular treatment. It is known as PRP, treatment for hair loss. Platelet-rich plasma treatment. What I actually do is I take 10 cc of the blood, patient's blood, put it in a centrifuge machine, separate platelet and growth factors from the red blood cell. We discard the red blood cells and take this white blood or plasma and inject that into the scalp. Now, the concept is we have stem cells present in our skin, and in our organs also, like in the kidneys and liver and heart. Now, when I inject platelet-rich plasma into the skin, the growth factors that is present in the platelets, they stimulate the stem cell in the scalp to produce hair follicle. Now, new hair follicle production appears, new hair follicles are formed, the already thin hair become thick, and the hair loss decreases. So this is a very effective, simple procedure. Patient require multiple treatments weekly or monthly, and with the passage of time, they can actually grow the hair back. So this is such a beautiful procedure, a minimally invasive procedure. Now,
is it very expensive?
no, it is not expensive at all.
Okay.
It just costs few thousand rupees, very, you know, 4 or 5,000 rupees, and you get the treatment.
Yeah, that's amazing. What is the name of this treatment again?
It's known as PRP treatment.
PRP treatment. So that is the treatment that Dr. Ikram Ullah is telling you about for men and hair loss, even women and hair loss as well.
It works better in women.
Okay.
Women come to me also with androgenic alopecia, because they do have at times polycystic ovary syndrome, where androgens are produced in the body, and they can have the same pattern of hair loss as men have. So I use the same treatment for female patient also, and in female patient the result is better than, well, equally better, or in fact I can say is much better than men. The other patient, female patient, talking about female patient, they have telogen effluvium. Now, telogen effluvium is a condition which can be due to pathological stress, psychological stress, or physiological stress. Now, pathological stress is if a patient has got tumor or is on anti-cancer drug, you must have seen that they lose their hair. Physiological stress, worry about the exam, or marriage situations, or different things which can give rise to psychological stress, can lead to hair fall. And physiological stress, which is basically after pregnancy. Pregnancy is a physiological phenomena. And most of the women, in fact 50% of the women, they lose hair after pregnancy. So in these patients, PRP treatment is very effective. Now let me slightly extend the discussion after mentioning one other last important factor about the hair fall treatment is that hair transplant is also being done.
That's exactly what I was going to ask you. Yes.
That is again is a very successful procedure, but it is an invasive procedure, but again the results are very good. But hair transplant procedure in females, I personally, that is my own personal opinion, I do not recommend, because like generally females have got diffuse alopecia, and if you take the hair from the back of the scalp, which is the donor side, the quality of the hair over there is not as good as it is in men with androgenic alopecia, where the hair graft will survive. In female, it seldom survives. So you are losing hair from taking hair from the donor side, and the patient loses hair from that side. And when you transplant it again, it would, because the hair follicle is thin, it would not get transplanted. So in female, I do not recommend hair transplant surgery. This PRP treatment, we can use it on the face also for skin rejuvenation.
Oh, I see.
Stem cells are present on the face. Now, if you inject the platelet growth factor into the skin of the face, the predominant cell over there is fibroblast. What does fibroblast do? Fibroblast stimulates the collagen. When the collagen is produced, skin gets rejuvenated. Now, Kim Kardashian, I think, that's her name?
Kim Kardashian, yes.
Okay, and Angelina Jolie?
Yeah, Angelina Jolie.
They are the one who do these procedures on a very regular basis. It's in...
Do they have side effects if you have these done on?
No, and it's also known as vampire facelift. You must have heard of that.
No.
Vampire facelift, because
it sounds scary, actually.
Scary in the sense that they inject blood into the face. Right. Obviously, though it's a white blood, but vampire facelift, and the result is very good. Now, honestly, the more you read, the more knowledge you have, the closer you come to Allah Almighty. Allah has created stem cell. What is a stem cell? Stem cell is a pluripotent, omnipotent cell. Stem cell is like, they are the type of the cell present in the embryo. So, two cells come together and form a complete human being. One egg and the sperm, they come together, two cells, and a complete human being is produced. Why? Because these are stem cells, and these stem cells are able to produce any type of cell they want to.
Right.
Now, for example, the stem cell procedure is being carried on in the knee joints for knee joint problems. So PRP is done over there also. In fact, if it is modified and further research is done, you put these PRP treatment sort of a treatment into the liver and produce liver cells, put in the kidney and produce kidney cells. You must have seen different animals, like a lizard. You cut the tail of the lizard and the lizard grows back the tail. Why does that happen?
Regeneration.
It's because of the stem cells.
Right.
Starfish, you cut one of the limb of the starfish and after a few months the same limb, the same length is reborn again. Why?
That's really,
That
really
is
interesting,
because of stem cells.
fascinating.
So that is why when in Quran, when Allah says that, you know, the human being will be created again. Humans have got the ability. You cut my arm, there are stem cells. If Allah wants, from those stem cells, the same arm will come back again. You cut my heart out, stem cells are there, new heart will appear within minutes, if Allah wants. So that this is something which, you know, is amazing.
It is amazing. It's absolutely
and the more
fascinating.
you read about, the closer you come to Allah.
Which is amazing. Okay, Dr. Ikram, tell us about some of the common things that you hear people, you know, complaining about, like dark circles, pigmentation, just various things that are going on with their face that are very common. Do you have to like resort to laser every time, or can there be other treatments that you can invest in?
Well, okay. Let's talk about dark circles. Now, why do dark circles appear? Dark circles appear because we do not have, like over here, I have got skin and there is flesh and then there are bones. Over here, you have got just the skin and underneath there's an empty space because you have got the eye socket.
Okay.
So dark circles are most of the time are because there is nothing beyond the skin over there, just the bone and the empty eye socket. So, and plus in some of the patients, the skin over there is slightly darker in color, like the skin of our knuckles in some patients are dark in color. It is not a disease or a abnormality. Mind you, dark circle does not represent any internal disease. It is not associated, like the popular myth is, with liver problem. Lack of sleep make obviously make your eyes look tired and eyes, you know, sunk in, and the effect of the dark circle becomes more prominent. So yes, it is temporarily you can get more prominent dark circles if there is lack of sleep. But as such, that is not a cause of dark circles. Now, dark circles can be treated in many different ways. You can lighten up the skin by different creams, but unfortunately, and I would again say unfortunately, most of the creams available in the market have got steroids and mercury in it, the whitening creams. Now, these will actually destroy your skin. Temporarily with steroid, what does steroid do? It causes vasoconstriction. When I constrict, vasoconstrict, when you, for example, when I press my arm, on my arm over here, you will see there will be a whitening effect over here.
Yeah.
You do that, everybody do that, you will press it and the skin becomes white.
Yes.
Why? Because I have constricted the blood vessels and the skin become paler in color.
Right.
So you have this effect of slight fairness. What does steroid do? When you apply steroid on the face, the vessel get constricted, the skin become pale, and all of a sudden you are looking, you know, fairer in complexion, and then you say, oh, this is
how
something
can one be protected from such things? How do you know?
You need to have public awareness. You need to have such programs, because when you use steroid for a prolonged period of time on the face, because of that vasoconstriction, the collagen gets damaged, the collagen thin out, the skin becomes atrophic. We call it steroid-induced atrophy of the skin. Then skin becomes more prone to infection. You must have seen patient using too much steroid on the face, ultimately will get pimples on the face. The skin is under distress. Whenever the skin is under distress, body start reacting. So the hair follicle, they also start reacting. Whenever you constrict the blood vessel of a hair follicle, or whenever the skin is distressed, distress signals are sent to the skin, and everything gets into production. So the hair follicle. So
there's total chaos going on.
Total chaos going on because of the hair, because of the steroids. Plus, it has got mercury, and mercury is poisoning. Mercury temporarily bleaches the skin, but in the long run, it will destroy the skin. So one thing I would advise my patient is to do not please use such whitening creams which have got steroid or mercury in it. It will not be written on the label, but most of the creams, whitening creams available in the market have got these two ingredients in them. Now, how I treat dark circles, I treat it in a very scientific manner. I inject carbon dioxide gas into the skin through a machine. When carbon dioxide gas goes into the skin, what is carbon dioxide gas? It will create hypoxia, low oxygen level. When there is low oxygen level, body will react and it will form new blood vessels. When new blood vessels are formed, the dark circles disappear.
Right.
This is the phenomena. How did we get this knowledge? For example, we have got the heart. Whenever we get angina attack, why is that? Because there are not enough blood vessels to support your, when you are exercising, to support your heart, which is producing too much consuming too much oxygen. So lactic acid is produced, hypoxia is produced. So whenever there is hypoxia, body reacts and new blood vessels are formed. We call it collateral blood vessels around the heart.
Okay.
So that's why we recommend our patient with heart problem to do exercise, so that slowly and gradually the collateral blood supply develops and that angina or that painful pain in the chest disappears with the passage of time, and you slowly and gradually keep on exercising. So this again, this is what I
do for
the dark circle, and the result is good.
Okay.
But your last question
Pigmentation.
was pigmentation. I mentioned about the different whitening creams, and I totally object to those type of whitening creams which causes, in fact, in the long run, though
they're actually detrimental.
You may have a good effect for a few days, but in the long run
it's
detrimental. There are different lasers that can be used for treating melasma or pigmentation, but again, very difficult problem to treat. I have tried Q-switch laser, I have tried Intel pulse light, and these days I'm using the V-beam laser, the pulse dye laser to treat melasma. So melasma or dry pigmentation on the skin is difficult to treat, and there is not just one particular method that would be successful. So you have to use different methods, and you have to advise the patient to stay away from the sunlight or use a sunblock, because sunlight will aggravate the pigmentation. This type of pigmentation usually occurs after pregnancy or during pregnancy, because melanocyte stimulating hormone, the MSH hormone, is produced in the body, and it leads to pigmentation on the face. Plus, pigmentation you can also get if somebody is using some sort of a makeup on the face and that makeup does not suit them. It can give rise to pigmentation. And one other very important aspect which most of the people do not know, and again, this is something which I developed the concept for the first time. Like I developed the concept of hair removal. I told you about
the tattoo, when
I
you're removing a tattoo
from a face of a patient in United Kingdom because he had initials of a previous girlfriend, and he wanted to remove that.
Of course.
And when I removed that, along with that, the hair follicle disappeared, and then I reported that as a side effect, and that's why. So we are talking about the pigmentation on the face. People who use hair dye get pigmentation on the face. You show me a patient, I would not look at their hair, I will look at their face, and I'll tell you whether the patient is using hair dye or not. Now, you tell me, doctor, we use hair dye on the hair, how the hell I get pigmentation on the face? What actually happens is, okay, I have dyed my hair, tomorrow, day after tomorrow, or maybe after a week or 2 weeks, whenever I'm taking a shower, I will stand underneath the shower, water will touch my hair, some of the dye particles will get mixed into the water, and it will trickle down on my face and the rest of my body. Those dye particles, when I dry up my face with a towel and I go out in the sun, those dye particles will be sticking onto my face, and when I go out in the sun, even for a second, they will act like a catalyst and will give rise to subclinical contact irritant dermatitis. Now, you will tell me what is subclinical irritant contact dermatitis is.
Yes.
Subclinical means that inside the skin, the body develop reaction inflammation, and that inflammation leads to post-inflammatory hyperpigmentation. Though apparently you would not get a redness. If it is redness, then it is a clinical contact dermatitis,
I see.
which is clinically visible.
Right.
Subclinical is that you cannot see it clinically, but inside the skin,
process has
the
started.
simmering is going on.
Okay.
The post-inflammatory hyperpigmentation appears. And in most of the patients, you get pigmentation of the face because of the hair dye.
That is really, really
Now,
informative.
this is something which has
Dr.
not been reported in the books. I have written a paper on it, which has been published, and I hope that soon it will be part of our dermatology textbooks, that hair dye on the face can give rise to subclinical irritant contact dermatitis on the face, subsequently would lead to hyperpigmentation on the face, and that can also give rise to itching on the body because the same water trickle down on your body also.
Absolutely. So, you know, those are amazing facts, insight that Dr. Ikram Ullah is giving us, and we are really, really lucky to have him in the studios today to pass on his expertise to us. Dr. Ikram Ullah, thank you so much for being here today. Unfortunately, we are running out of time, as we always do. This is, I would say, a massive subject, and we would really be, you know, it would be a pleasure for us if we could have you on again for a couple of more programs to discuss more of these issues.
It was a pleasure. Thank you very much, and I feel obliged and honestly, I'm grateful that you have invited me to this esteemed program.
Thank you very much. Well, viewers, you've had an insight into skin conditions, many things. We've learned many things today, many things that we would think were a sort of an everyday issue that we would not really think about. And you've been given a lot of information right now that you can take home with you, and you can understand, and whatever suits you and whatever advice, whatever treatment you need, you can apply that to your life. And why not look after yourself and put yourself first and work on your self-esteem, because if you look good, you feel good. Remember to contact us on our Facebook page, Health is Wealth. We want your questions there, we want your feedback there. And until next time, goodbye.